Hi, I'm Colleen Cusick. I'm the Director of Materials Management for the Johns Hopkins Hospital in Baltimore, Maryland, and I'm here today with Jean Sargent, and we're going to be talking about basic supply education for nurses.
Great.
Hi.
Thank you, Colleen. So why did you decide that this was an important topic?
As a nurse and a supply chain professional, I was able to really see that nurses get frustrated about supplies and they don't have a clear understanding where their supplies come from. They don't know how to handle supplies that may be defective, and I just really felt very strongly that they needed to have some clear understanding.
So how did you go about determining what you were going to speak on?
There's lots of topics about supply chain that we could touch on. The most often, obviously, it's interactions, it's the processes, it's safety, and it's also about the financial impact. While we don't want to make that the number one piece that we talk about with clinicians, but it is definitely something that we have to think about.
Why do you think others aren't performing this type of education?
I think that supply chain leaders are really not maybe set up to do it. They may not have people in their shops that have the skill set to put together. They may feel they don't have time. So there could be a number of reasons that they can't do it. And some just don't think about it.
Yeah. And actually what I see is that they don't think about educating their own staff. And they're not educating their staff,
right.
So how would they be able to take it out to the clinicians?
Well, and I think that's really kind of a negative for us in supply chain, that we really don't put a big emphasis on training, whether it's our own staff or it's training, our customers.
So how did you develop your program?
So when I first started, I started about 4 to 5 years ago. I just sat down one day and I said, I'm going to decide on topics and I'm going to put it together. And because I have contacts within our Department of Nursing, I was able to solicit, for the opportunity to actually put this together, put it in the catalog, and allow people to come to classes, as well as I take the show on the road. If the staff meetings, if they give me time, I will also do that.
In the past, I've tried to get onto the clinicians' education orientation, and each time I was told, there's just not enough time. There's too many other important things, and it's difficult for us because what we're doing is very important to what they're doing, and for us to support them. But
it is very hard to have clinicians understand that you do need to know about this. You use supplies all day long, and we want you to have them when you need it, the right time, in the right place, and ones that are good for patients.
Right, and it's not magic.
Exactly, exactly. It's
so
work.
Yes, and I think that's great that you're helping them to understand that when we're out of something, it's not because somebody's being malicious, it's the process is broken, and there's a big supply chain behind us that we depend on.
And I think nurses and other clinicians don't always know, that there is a national back order, and it's not just us looking for it; it's hundreds of hospitals looking for the same products. And I think the biggest feedback that I get from nurses when they're in the class or when they have opportunities to ask questions is they're always surprised, that oh my gosh, this is what's happening, and this is the work that you do, and and that we're really just not stocking shelves. There's a complex process behind the whole.
Well, and I'd like to try to give people their kind of real world examples. So the recalls that occur at stores, well, that has a downstream effect for everybody. So it's very similar with the medical products.
Exactly. And you bring up recalls, and staff have no idea the number of recalls that happen, and the work behind it. Whether we have the product or not, we still have to make sure that someone didn't buy it, and it's hidden in somebody's drawer. Exactly.
Yes. So how are you able to change your presentations based on the different types of facilities?
So what I try to do is I make sure that I understand their process, because at my hospital where I'm primarily stationed, is different from my community hospital.
Right.
And so things that go down, happen down in the academic center will be definitely different in the community.
Different. So how do you know that your educational offerings are successful?
So what I actually did, I was working on my doctorate in nursing practice, and I chose that as my topic.
Okay.
And what I did was I did a convenience sample of nurses, and we did before and after surveys, and were able to successfully show that these classes that I did for them and the other ones that I've done, that they actually did learn from it. And there was a lot of good positive feedback from them. They supported that nurses should have some understanding about supply chain. And I think with that, they might not feel great if there's still a back order, but they'll at least understand,
Absolutely.
and at least know that somebody's working on it.
Good. And so did they pass the word on to their colleagues?
They did.
That's great.
And so I've had additional classes and with leadership. And so what I'm actually going to be doing is turning it into a module that nurses will be able to do at their leisure with their other, and the nurse managers can make it a required course.
So what are some of the challenges that you encountered?
So I think the biggest challenge is having nurses come to the class, because it takes time from their patient care activities, and that's the biggest challenge that I hear. And plus, in order to have an effective class, it's not a 10-minute class.
Right.
And I do a 90-minute class. I also offer a tour, and so if you want to see the area, see the different things that we do and how we get it to you. I think that also is a good way to have a good visual.
Sure, because all they think about is there's stuff happening downstairs. There's a dock and some trucks come and go.
They don't know where it is. They don't know how to get to it, and I think that helps with the understanding as well.
Congratulations and thank you.
Well, thanks, Jean.